New tonight, Houston Medical Center might not be able to help you right away if you are a non-emergency patient. That's because they had to close the medical unit. Milledgeville went to Warner Robins to find out why.
Houston Medical Center didn't tell me which unit was closed, but they said it has to do with the national worker shortage with healthcare professionals. They say it's closed because they don't have enough nurses to keep it open. An understaffed hospital isn't rare these days.
We really rely on their services.
Spokesperson Kevin Raleigh says the 30-bed unit has been closed for about 4 weeks.
This last March, I unexpectedly had a stroke. And so I made it here to Houston County within that 3-hour window, and if their services weren't available, not quite sure what would have happened to me.
Chris Bill says Houston County relies on the medical center.
That's our main hospital, and we need that care, we need that support.
Raleigh says they are working actively and aggressively to recruit nurses and will reopen the unit as soon as they have the staff hired and trained.
Nurses have a lot of responsibilities. As far as nurse-patient ratio, work long hours, 12-hour shifts, a lot of overtime.
And the list goes on. Kelly Harden is married to a nurse. He says nurses are leaving the profession, so he wasn't too surprised to hear they are understaffed.
Hopefully they'll get more people into schools, nursing schools and college, and can be able to do more hiring. But the standard should be high.
We do have a big community, and it continues to grow.
Raleigh says they are not limiting patients, but they could be on diversion, which means the hospital is full, and for non-emergent patients, they could be waiting for a while. In Warner Robins, Molly Jett, 13W, Amazing News.
Raleigh could not estimate how long the unit will be closed. He also was not sure how many nurses they would need to reopen that unit. Tonight, we're taking a closer look at the nationwide nursing shortage. Last year, the American Association of Critical Care Nurses surveyed more than 6,500 nurses. They said 92% reported the pandemic had reduced the number of nurses at their hospitals. And as a result, their careers will be shorter than they intended. 66% said they were considering leaving the profession because of their COVID-19 experiences. And 76% said unvaccinated patients quote, threaten nurses' physical and mental well-being.